pleased to be bringing you this policy round, which will share findings from research supported through one of our signature initiatives, the Evidence-Informed Healthcare Renewal. And this particular presentation is from research funded through our Healthcare Renewal Policy Analysis funding opportunity. And this funding opportunity was launched in 2011 as part of EIHR, or Evidence-Informed Healthcare Renewal. This Healthcare Renewal Policy Analysis grant competition was designed to support the generation of health policy analyses to offer policy and decision makers evidence-informed policy options on health and health systems outcomes for healthcare renewal issues of high importance. A selection of research funded through this opportunity will be featured in upcoming policy rounds as well as on CIHR's website. And the link to those research profiles, Hawa will post that for you. In addition, I'd like to acknowledge the relevance of today's session in relation to CIHR's strategic initiative on e-health innovations, a partnership between the Institute of Health Services and Policy Research and the Institute of Aging. The e-health innovation partnership program is focusing on intersectoral development of health technology in 2 areas, one of which is home and community support for seniors with complex care. So very much related to this presentation. This funding opportunity will tap into strategies and tools that will target not only the patient's but the caregiver's journey as a support mechanism and part of the care team. So for more information, you can go to CIHR's website, and again, we'll post a link on the screen for you to have access to. I'm also joined by my colleague Sharon Nadeau, Assistant Director of the Institute of Aging here at CIHR, and she's just got a few words of welcome and comments on IA initiatives.
Thanks, Jennifer. So in addition to mentioning that the presentation is very well aligned with the CIHR Institute of Aging, we'd also like to mention that the webinar is relevant to our second strategic direction of our strategic plan, which is addressing the complex health challenges of older adults. I'd also like to highlight the research currently being funded within the Canadian Consortium on Neurodegeneration and Aging in the Quality of Life theme, which focuses on improving the quality of life of those living with Alzheimer's disease and related dementias, and those who support these people that have dementia. We'd also like to highlight the importance to the Institute of Aging of additional research in this area to be funded, and we do currently have an open funding opportunity, which is a team grant in the area of late life issues that's currently posted on the CIHR website.
Great, thanks, Sharon. So lots happening at CIHR in this realm and related to this topic. So just to outline the learning objectives that underlie this session today, we want to review results of recent research on caregiving, discuss the potential effects of unpaid caregiving on the Canadian economy, identify key elements of a proposed caregiver strategy, and finally understand the potential policy implications of this research on the healthcare system and Canadian businesses. So to quickly outline how today's session will unfold, I'll introduce the speakers. We'll hear from the research team first, and then after we'll hear from Janice Keith, who will speak about the policy implications of the research presented. Following that, we'll take questions through the chat mechanism, and I'll help facilitate that and direct the questions to the speakers. And when the webinar closes, I'll just mention that there will be a short survey that pops up, and we would really appreciate if you could take a couple of minutes to do that before you sign off. So without further ado, I would like to introduce the speakers for the webinar today. Our first speaker is Dr. Samir Sinha. He's a passionate and respected advocate for the needs of older adults. Dr. Sinha currently serves as the Director of Geriatrics at Mount Sinai and the University Health Network Hospitals in Toronto. In 2012, he was appointed by the Government of Ontario to serve as the expert lead of the Ontario Seniors Strategy. Dr. Sinha's breadth of international training and expertise in health policy and in delivery of services related to the care of elderly have made him a highly regarded expert in the care of older adults, not only in Canada, but also internationally. And with Dr. Sinha is Dr. Jeff Anderson. He is a professor in the Institute of Health Policy Management and Evaluation, the Faculty of Medicine at the University of Toronto, where he holds the chair in Health Management Strategies. His research on health systems and quality of care has been funded by granting agencies in Canada and the United States, and he has published extensively in scholarly journals. He has also served on advisory committees to federal and provincial governments in Canada. So Dr. Sinha and Dr. Anderson are the research leads here for this session today. And our third presenter, who actually wears many hats, but today Dr. Janice Keith will be speaking with us with a policy lens, looking at potential impacts of the research that will be presented. Dr. Keith is not only a full professor in the Department of Family Studies and Gerontology at Mount St. Vincent University, and was selected as Mount St. Vincent's first Canada Research Chair in Aging and Caregiving Policy, which she held from 2002 to 2012. She is also currently serving as an expert advisor to the Employer Panel for Caregivers under Minister Alice Wong, and will share some of her insights today on this in today's discussion. So welcome to our speakers, and thank you again for joining. I'm now going to turn things over to Dr. Sinha and Dr. Anderson to review the work that they've been doing through this Healthcare Renewal Policy Analysis grant. So we'll pass the ball over to you, Dr. Sinha.
Thank you very much. So I'm here with Professor Jeff Anderson, and we're going to share with you a little bit about the work we've done in Ontario to date, working in partnership with the government, and in particular working part of a really great team, not only involving Jeff and myself, but with two excellent medical students, Christina Reppes-Rindesbacher and Emily Stewart, as well as our international collaborator, Martin McKee, at the European Observatory, affiliated with the London School of Economics. So we'll advance to the next slide here. And really we start with our dilemma here. And our dilemma is that the ways in which our cities, our communities, and our healthcare systems are currently designed, resourced, and organized and delivered often disadvantage older adults. There's a lot of work going on right now around age-friendly cities, also work going on around thinking about how our healthcare system was designed for a much younger population. But we know that our current systems and our structures beyond healthcare and within healthcare often disadvantages older adults with chronic health issues, and in particular, those who care for them as well. So this is a focus on caregivers. So to start off with, we just wanted to talk about what were some of the leads or reasons behind our work on developing a caregiver strategy for Ontario. So when we started working on this, the work that predated this was the work around developing a senior strategy for Ontario. So in the policy context of Ontario, in 2011, the government created a new vision statement to make Ontario the best place to grow up and grow old. They felt that the best way to do this was by focusing on developing a senior strategy, and so this sort of work started in 2012 to look at creating best practices and policies at a provincial level. There were some core principles that came out of this work, and those were focused around the ideas of equity, quality, access, value, and choice. These were principles that the public and stakeholders felt that any recommendation should be adhered to, and really with the recommendations that would be underlying the strategy would really focus on how do we keep older Ontarians staying healthy and independent for as long as possible. So there's a lot of stakeholder dialogues that occurred, and this included during the summer of 2012 over 5,000 older Ontarians themselves, 2,500 frontline providers as well as municipal officials and others. And in particular, we really focused on making sure that caregivers were a clear voice within these consultations. And the fact that our team knew that caregivers in particular, just due to the nature of their role, would probably have a tough time getting out to consultations. So we decided to be even more proactive, partnering with the Ontario Caregivers Coalition, who was able to survey caregivers that they were linked into. But the ministry also commissioned a survey with over 800 caregivers, doing telephone surveys with them. And this helped provide the bulk of the data that also made sure that we were capturing their views, and then that could inform recommendations towards supporting caregivers. As I said before, we had many stakeholder groups involved in this, including prominent groups like the Ontario Caregivers Coalition and others that really were speaking to the voice of caregivers. And all of this work culminated in the development of a report called Living Longer, Living Well, which is available on the internet now as well. In the report itself, you'll see on this slide here, we talk about the key strategic themes and areas of focus, and really what you see here were the 12 chapter titles as well, which really revolved around the themes that were outlined here as well. And you'll see this focuses on everything broader, everything involved with the healthcare system, but you'll see that the first ones really focus on issues such as elder-friendly communities, and also how do we actually focus on health and wellness as opposed to just care as well. But you'll see down the line highlighted in red, there was also key emphasis on making sure that we had a focus on caregivers, and they received their own chapter where we talked about what we learned about caregiving in Ontario, and then and that helped us also frame the recommendations we made around focusing on advancing the needs of caregivers for the province. So what we started learning about caregivers in general, and some of these facts are at a national level, and then there were others at a provincial level as well, but we know that over 1 in 5 Ontarians, for example, serve as a caregiver to a family member and often provide 70% of their total needs. We know that the majority of unpaid caregivers tend to be women. We know that 98% of older adults receiving paid support, and this stat varies in jurisdictions, but it's always in the 90s in particular. But we also know that the majority of people receiving paid support, so traditional home and community care services through the government, also receive additional support from an unpaid caregiver as well. We know that unpaid caregivers, and again, this is a number that's debated, but certainly we know that the value of the unpaid care that's being provided across Canada is certainly in the billions. And we know that many caregivers as well report that their obligations as a caregiver result in higher levels of stress, especially when having to balance work and other family obligations. And finances often appear to be the greatest source of stress for the caregivers we surveyed and caregivers from general that we, when we look at these issues within the broader literature as well. More particularly in Ontario, in that survey of over 800 caregivers, and again, to be involved in that survey, you could be of any age, you just had to be providing care to an older Ontarian. We found that 38% of the caregivers we surveyed indicated that they were unfamiliar with the publicly funded home and community care services that were available. This was particularly concerning for us because we know that the patients or the individuals, the older adults, these caregivers are supporting could often benefit from services that are publicly available for them. We also know that 24% of Ontario caregivers were aware of the Healthcare Connect, or which is a primary care locator service. So again, when we found that caregivers were often saying that their loved ones had lost their primary care or needed new primary care, many weren't even aware of a program that had been created to help them actually locate a new primary care provider. We also knew that 24% of the caregivers we surveyed reported that they were coordinating the care of the individual they were looking after. 21% of caregivers reported that the primary care provider was actually doing this role, while in 54% of the cases of those individuals we spoke to, they indicated that nobody seemed to be coordinating the recipient's care. So again, what this really showed us is that there were significant gaps in meeting the needs of caregivers and those individuals they were looking after as well. And so this prompted further questioning and further work to say how could we further strengthen the roles that we could support caregivers in Ontario. So this started leading to questions about, do we actually need a specific caregiver strategy for Ontario? And so this work from the senior strategy certainly led to a collaboration between myself, Dr. Anderson, and others to say, could we utilize the CIHR's funding opportunity here to advance research in this area and thoughtful policy option creation as well. So it was clear that when considering a caregiver strategy, and apologies for the spelling mistake there, in the title, Ontario's caregivers could clearly be better supported with better access to information and support services, and that they also have significant financial needs as well. While there are some existing federal caregiver benefits, they are limited and do not meet the needs of many Ontario caregivers. And Ontario caregivers have varying levels of access to public-funded respite services and support programs. And so the Ministry of Health has previously identified better meeting the needs of caregivers as an economic and social imperative. And so again, a lot of work has actually been occurring around better meeting the needs and thinking about the needs of Ontario caregivers in particular. So this is where our work started around this particular initiative. So as we said, our CIHR grant that we're grateful for receiving provided us the opportunity to partner with the Minister of Health and the Premier's Office in Ontario to conduct an evidence-informed process to develop practical policy options for the Government of Ontario to consider. While we certainly started building on some of the work that I had helped lead in the development of the senior strategy, we certainly want to build, to do more work on a more in-depth level and also bring in international and national experts to help us in this work as well. So this is where Jeff and I were able to engage Martin McKee from the European Observatory based in London, and certainly to help work with us on how we could actually look at this from an international lens, and certainly with Christina and Emily, our hardworking summer students and ongoing medical students who are in the LEAD education program through the University of Toronto Medical School, we then really started back to basics by conducting a comprehensive literature review and a jurisdictional scan to understand what policies and supports for caregivers have been established within and beyond Canada. We then we worked collaboratively to develop an evidence-informed policy options document to then invite international experts and provincial stakeholders to provide further advice around through a facilitated stakeholders conference as well. So the stakeholders that we certainly engaged were, as you'll be hearing from shortly, Janice Keith, Martin McKee, who I mentioned before, Adelstein Brown, who's the Director of the Institute for Health Policy Management and Evaluation at the University of Toronto, and in his previous role as an Assistant Deputy Minister in the Ministry of Health here in Ontario, did a lot of work around caregivers and thinking about how the ministry could play a greater role in supporting caregivers. Lisa Levin, who is the chair of the Ontario Caregivers Coalition, participated. We had our project manager, Susan Tremblay. We had our medical students, as you've heard about before. And then again, on February 25th, we gathered provincial stakeholders, including caregivers, care providers, and related organizations, to come together at a special day where we could actually focus on these issues in particular. During our process, what we did was we examined a broad set of issues under the two broad themes of what employers and governments could do to support caregivers. And this is really through the work that we did in developing our policy options document. We really saw that there was a broad employers theme, recognizing that many caregivers out there are actually working caregivers, and saying, you know, what are the things that we could do in particular to support working caregivers. Then there was a broad governance theme, if you will, recognizing the government's potential role in supporting caregivers with financial support, but also in other areas in terms of legal protections and in the home and community care support that they could create as well. So as we started working on thinking about recommendations, because that day that we talked about where we brought everyone together was one where in advance we shared the policy options document that we had created. We then really organized our day's conversations around those two broad themes in particular, and then we asked the group to really engage with us in thinking about how we could make some overall recommendations. And these were the criteria we were really focusing on. We wanted really there, if we were going to present recommendations to our Minister of Health, for them to be evidence-based. For example, we wanted them to be relatively easily implementable if possible. Again, not making that an absolute qualifier or barrier, for example, but knowing that things that are more easily implementable are more likely to be implemented as well. We want to make sure that it can, wherever possible, build on existing resources and infrastructure in our province. We want to make sure it could reduce barriers for various vulnerable groups. We also want to make sure that alternative funding sources, if possible, could be available. So are there existing ministerial funding envelopes, private sector resources that we could leverage, for example, and making sure that it also aligned with the government operational plan, political priorities, and then also that it could be publicly palatable, especially to key stakeholders as well. So again, what you will see in terms of what we came up with certainly had all of these ideas in their consideration as well, and that's why we want to put the proviso that when we worked with the group overall and then worked with our key stakeholders that you saw as well, that were involved in helping to create the final briefing note and then be involved in briefing the Minister of Health the following morning after our stakeholder day. We want to make sure that we really thought about these things to create Ontario-specific recommendations. So finally, I want to just present the final themes and recommendations. We came up with 3 in particular, and then I'll tell you where we're at today in Ontario. So the first one was really thinking about that theme of enabling employed caregivers to continue to work in care. You'll see the context that we put there. I won't read it out in detail, but really the overall thinking here was that many of our caregivers currently are working caregivers, and that we know if we don't actually have a workplace that can be flexible and that can be accommodating of the needs of caregivers in particular, some may be forced to prematurely depart from the workforce and from paid employment, and this can create significant losses for the caregivers themselves, for our overall economic productivity and competitiveness as well. So we came up with a recommendation as a result that really focused on the Ontario government taking a leadership role in bringing businesses together and really focusing on how it could celebrate champions, in terms of employers that are really focusing on meeting the needs of working caregivers and identifying and promoting best practices. In particular, in our jurisdictional scan, we saw that a lot of work is happening around this in places like the UK, where many businesses see that supporting working caregivers is not only good business for themselves, but also is a great tactic, if you will, to employ and also to recruit highly talented workers who may also be working caregivers. So we've really felt that this initiative, where the government may not necessarily take a lead, but could certainly provide an empowering role, could strengthen a workplace culture in Ontario to more fully address the needs of working caregivers. Going on to our second recommendation, this starts looking at what the role governments could actually do to better enable and support caregivers. And really we heard loud and clear that many caregivers, for example, were working with care recipients, if you will, who were actually also receiving home and community care services. And we know that home and community care agencies are actually mandated in our province to provide services such as respite, but we know that access and the availability to these services can vary considerably as well. We also heard that sometimes what was most frustrating for caregivers was that the needs of the folks they were looking after were often being assessed, but not necessarily the needs of the caregivers as well. And this could often lead to increasing caregiver burden. So a recommendation was, again, that as many of these individuals were working with individuals who are receiving home and community care services, we want to focus on what was happening in areas like the United Kingdom, but also in Quebec, where caregivers will be given an opportunity, where we mandated that caregivers are given an opportunity to have their voices heard and needs assessed. So the idea that if someone is actually being assessed for home and community care, that if they identify a caregiver, that we actually mandate that the caregiver's voices be heard and their needs be assessed as well. We felt that this would allow for better outcomes and more effective use of home health and community resources and raise the overall quality agenda in the home and community care sector. Our final recommendation, again, along the lines of what the government could do to empower caregivers, was also thinking about the role that income supports could actually play as well. Given that caregivers in Ontario were telling us that the financial stresses were some of their greatest stresses in terms of being a caregiver, we were able to find out that through our survey work that caregivers in Ontario whom we surveyed reported spending over upwards of $4,200 annually in supporting the care costs for an older adult with complex care needs. We also know that existing caregiver benefits, whether they be federal or at a provincial level, can vary considerably as well. So that existing caregiver benefits that actually exist sometimes exclude spouses, for example, who are often the majority of caregivers. They also sometimes exclude neighbors and friends, for example. So sometimes caregivers cannot receive benefits for caring for an individual unless they actually live in the same house, so as a dependent, but not necessarily as a spouse. So again, there are often many restrictions that exclude neighbors and friends, and may even exclude spouses, for example. So sometimes people are left going, well, who actually benefits from that caregiver benefit in the end? And especially we noted that low-income caregivers are particularly vulnerable, including those who need to give up paid working opportunities. So really we want to focus in this recommendation on building on the success of a benefit that exists in Ontario as well, called the Ontario Child Benefit. And in line with the province's poverty reduction strategy, we were proposing that Ontario introduce a caregiver benefit for low and moderate income caregivers who meet specified needs tests as well. So in terms of our overall timeline on developing an Ontario caregiver strategy, again, I want to be clear that this is not something that the government itself has actually said that it is creating a caregiver strategy, but more this is an opportunity where they were willing to partner with us as researchers and saying, you know, how could we actually think about what this could actually look like? So back in the summer and fall of 2013, after we received our grant, we started doing our policy themes research and identifying possible recommendations. In the winter of 2014, so in February 2014, that's when we actually led to our Caregiver Stakeholder Conference in partnership with the Minister of Health and Long-Term Care. The Minister came to our conference and helped kick it off with opening remarks and giving a call to action for our stakeholders and our key experts to help prepare for a briefing the next day. The briefing with the Minister's office occurred the following day, and then following that, briefings with the Premier's office and ministry officials occurred as well, based on the recommendations we came up with. Following that, again, talking about the politics and how that actually gets in the way of things, in the spring of 2014, only a few months after these dialogues were occurring, a provincial election was actually called. And for the first time in Ontario, we actually saw that caregivers and two of our caregiver recommendations actually made it within the actual planks of two different parties. So we knew that people were at least listening and seeing that caregivers were now a political issue in our province. In the fall of 2014, we also started partnering with LSE Health to develop an international policy options paper on caregivers. And this really, again, built through our connections with Martin McKee, were related to work that LSE, London School of Economics, is already starting to lead, looking at international comparisons of caregivers and policies in European countries. And then after the election and that settled down, our current government's Premier and Minister of Health have now mandated that a new MPP that has been elected be put in place, has a mandate letter now to champion the development of a caregiver strategy for the province, and we are partnering with this individual as well. So again, a lot of work that's been going on over the past few months, and the past year, and we thank you for your time and attention.
Thank you very much, Dr. Sinha. That was terrific, and I will hold questions for now until after Dr. Keith's presentation, but I do want to just draw everyone's attention to the chat screen with a link that Stephen Lott has provided to all attendees with evidence around education and support interventions for caregivers. So we'll move forward then, and Janice, we'll pass the ball to you to cover your presentation.
Great, thanks very much. You can hear me okay?
Sounds great.
Okay, great. So the slides, I assume, are coming up shortly. I'll just to give some background to the folks on the line. So I was one of the invited guests to the Ontario workshop, and from there talked about a broader sort of ways of supporting caregivers and caregiving in Canada, what some of the policy options are, and what some of the challenges to those policies options may be. So that's essentially what I'm going to talk about. Just getting my, there we go. So just to start off, I think this has been well stated by Samir that family and friends are often invisible and unrecognized, but they're so critical for us. And I like this metaphor of the roots of a tree, because there's all different types of trees and all different types of roots, and families also take, and family support systems also take all different ways of being and can be quite complex at times. So we have to keep that in mind as we try to think about policy that may fit the heterogeneity of family and friend caregivers. But I think what's important is that they need to be recognized for their own needs for services and support. At the same time, we have to think about where we target public policy. And I always get a little bit nervous when we start talking about there are 8 million caregivers in Canada and there are 5 million workers. Some of those are very important, but they're only doing supportive types of help to individuals. So we do have to be careful that we target the caregivers who need a certain amount of help to provide care to an individual. So I want to keep that in mind. A number of years ago, when we had a minister for families and caregivers, I was asked to speak about the system of supports for caregivers. And really, there is no system at the moment. And I think this is what I was trying to convey. It's very limited. It's inconsistent. Their role as caregivers is very much ambiguous. We want them, we need them to be involved, but we don't necessarily see them as a partner in care. We see them more so as a resource, that they're helping to save us dollars in our healthcare system, but not necessarily viewed as an individual who has the right to have support services in and of themselves, i.e. we do not assess what their needs are, and that came out particularly in the Ontario workshop. So we have these different areas in the federal government. We know we have some policies around compassionate care at the end of life. We have some non-refundable tax relief. We have provincial range of different provincial programs, education and information. Sometimes provinces actually help to support caregivers organizations to get up and running and provide a valuable service to the community, like our Caregivers Nova Scotia, where I am from. We also have a number of private agencies that provide this support, and we have community agencies. But there's a lot of challenges related to that. The tax credits are non-refundable. There's a lot of variation by province, and I'm going to highlight a couple of those challenges by provinces, particularly when we talk about financial support for caregivers. Of course, if you're going to engage private agencies, you're going to need financial resources to do that, and it's often not available in rural areas of our country. So again, the rural-urban issue is really important as well when it comes to voluntary organizations. So then, how do we best support caregivers? And this kind of leans me into starting us to think about who are we trying to support and for what reason. And maybe it's more than one aspect. And I think the recommendations that came out of the Ontario work really demonstrate this dualism in sort of policy domains. So if our purpose is the productivity and economic vitality of our jurisdiction, then we may want to go through we want to keep people engaged and involved in employment. And so we may want to look to more formalized workplace policies that are available for all employees, of which some are caregivers. So that's one approach. That's certainly the approach that we took in the Employers for Caregiving panel that I was a part of, and I'll speak about. Another approach is to have the provincial and territorial broader public policy that's targeted to caregivers, which would be in the realm of the financial support that Samir talked about, of which some of those caregivers may be employed. But this would not penalize people who have left the labor force in order to provide care to an aging individual. So we do have to recognize, of course, we have 13 different jurisdictions across Canada, and any policy needs to be understood in the particular context in terms of that home and continuing care services and some of the other income security and labor standards, et cetera, that may exist. So I'm just going to give a highlight of some of the other ways we could be supporting caregivers, and I think we need to think about it across the different sort of groups that are involved in this work. We do have the individual caregiver and their families, we have government, we have the voluntary sector, and we have the private sector. And this really welfare diamond needs to be understood in terms of having a breadth of opportunity and supports for caregivers. So these that I am speaking about here are primarily within the provincial policy realm around health and continuing care. We can certainly begin to enhance our home care program, our respite care, and recognize caregivers as clients in and of themselves and assess that caregiver needs. What is it that caregivers need to be able to help them continue to provide the support? We certainly can look to our labor policies, enhance our employment insurance policy around compassionate care benefit, improve our labor standards. The work around the employer panel for caregivers whose report was released last month, and I have a link for it at the end of my presentation, really talk to employers to see from their perspective what were some of the best practices, what were some of the practical suggestions that those employers would have for other employers to try and support caregivers. And they really knew that caregiving was happening, but they didn't appreciate just the magnitude of it from our work and from our consultation with over 100 employers across Canada. They wanted to do the right thing, but they were uncertain about what the cost would be. And the second phase of this report that you'll be interested in is the business case that will be is just underway right now. But really, they felt as a snapshot, and what we learned was to be very flexible in their approach and to be creative, learn to remove some of the barriers to people remaining in employment, and try and leverage some of the technology that exists that may be able to help enhance employees to remain connected to the labor force. And just on an interesting note, I just had an email from folks in the UK when they've just released a press release today around supporting caregivers to stay in paid employment. So they've got 9 different pilots that are, some of which are using technology to help employed caregivers to try and maintain a sense of well-being at the workplace. We do need to think about improving our working conditions for our workers so that there are home care workers, frontline workers that will be able to help the family caregivers provide care in the community. If we don't have good recruitment and retention, people are on wait lists, they get burnt out, and so on. Then there's this whole area of income security, and there's many different ways in which we can try and improve access to better financial support for caregivers. One is a direct support through a caregiver benefit or allowance that I'll speak a bit more about. Other ways can be through pension schemes, reducing the penalty for people who drop out, or paying pension credits when people aren't in the labor force because of a caregiving responsibility. We tend in Canada to use the taxation system significantly, but we rarely, except in a couple of provinces, those tax credits are not refundable. Therefore, you have to be paying taxes in order to be able to benefit, which is a problem because the caregiver may have left the labor force, they're not a high income earner, and they're not eligible for a reduction in their taxes because they're not paying taxes to begin with. So there is a challenge connected with some of our current tax systems that could be expanded. In other countries, they've also had state pay the employment and sickness insurance, so workman's compensation for informal caregivers, so they are protected should they get hurt while doing the job of caregiving. So it's another whole area. I think what's important, though, is we do need to talk to caregivers, and some of this work that I'm speaking about has been published in a book around blurring the boundaries. Others are available in other articles that I'll speak to, but above all of this, I think we have to think about this need for caregiver assessment to really ask the caregiver what their role is. We've done an international comparison about a number of years ago looking at financial policies for caregivers in 10 different countries, trying to examine this the direct labor policies in order to see how it would be applicable for Canada, and there's some interesting learnings from that, and they're certainly available online for anyone who would like to use them. But I'm actually decided, since we were talking about Ontario, it would be interesting to actually look at some of the provincial policies in this whole area that may link to what Samir was proposing to the government about a year ago. So in Canada right now, we have at least 3 provinces and some more. I know that there are distinctiveness whether we talk about individualized funding models to support people in their own home, of which some could actually financially support a family member. So there's a current pilot in Newfoundland, for example, where families can actually be paid to provide the care, but again, it's a pilot and it's within sort of an individualized funding, self-managed care program. And that may be, I know it has been used in British Columbia and in Manitoba as well, but there are other places that have some unique aspects. For example, I want to speak to the Manitoba Caregiver Act, Caregivers Recognition Act, and I'll talk a little bit about our experience in Nova Scotia with the caregiver benefit. So in Manitoba, they took the approach of recognition of caregivers. They have a day, they have an advisory committee, they have guidelines for any type of future policies that there has to be a caregiver lens essentially applied to make sure that it's not in any way negatively affecting the caregiver. They have primary caregiver tax credit that I'll speak to next, where it's a refundable tax credit. And of course, they have other continuing care services and respite. In Nova Scotia, we have, of course, a range of respite services, like many provinces, respite beds and long-term care. But we've also given some support to Caregivers Nova Scotia from the province to help to deliver education, to provide some navigation services and so on. And we have a caregiver benefit. So I'll talk a little bit about that. We also use a taxation system, but again, it's non-refundable and not always, from my perspective, not always meeting the needs of the people who actually need it. I call it the inverse care law. The people who have the accountants who can figure it out, they're the ones who get it, and they may not be the ones who actually need it. So just to compare Manitoba and Nova Scotia for a second, so they have a refundable tax credit. It's provided 4 times a year, sorry, it should be, not a month. And in 2002, it was increased, so overall it's about $1,400 a year. They're also eligible to receive home care services in addition to this refundable tax credit. It's assessed through the care coordinator within the provincial home care program, and it's not means tested, which is a really interesting aspect of it, and neither is it taxable. So it's something that goes through the taxation system, and so there's some challenges, but because it's not, because they're not necessarily on an ongoing basis connected to the home care agencies. They may be, but they're not always. So each caregiver can be caring for up to 3 care recipients. So $1,400 a year is not a lot of money. We're talking $100 plus a month, but it's still a recognition of the work that they're doing, and it's refundable, which is not available in many other places. Nova Scotia has a more generous program where it's $400 a month, but it's also more restricted in that it's done through the MDS-HC clinical assessment at the very highest need for a very high level of functional impairment. And you can see some of the criteria there. There's also the client has to meet certain income criteria as well, and the caregiver must be providing at least 20 hours of care per week. One of my colleagues, Grace Warner, and her colleagues have looked at some of these cases and clients, and she's given me permission to share some of the results with you. And they looked at the administrative data over a 5-year period to assess the impact. So this is a slide that really talks about all continuing care clients during this period and those that were eligible for the caregiver benefit. So living with the helpers, you're slightly more likely. Resisting care. I think what I want to point out is down below is that about 10% of the people who were eligible for the benefit actually applied for the benefit and received it. Okay, so that's an interesting component of that. Secondly, they examined whether or not the client was likely to be admitted to long-term care over that 5-year period. So what were the factors that would have contributed to going into long-term care? Of course, somebody's age. Of course, if they live with someone or versus living with alone, they were less likely to have gone into long-term care. More likely if they had dementia. All not surprising. One of the things that I think was interesting from their study is that the clients who received a caregiver benefit were over 56% less likely to be admitted to long-term care, even when accounting for all of these other factors, like dementia, like living with, like age. And so there seems to be a protective effect, shall we say, of this particular caregiver benefit. We also, one of my master's students, looked at data around the inactive clients. So if what happened if they were on the benefit, they either died at home, they were currently inactive, they moved, many eventually did move to a long-term care facility within a certain period. We were looking at 1,300 clients. And among those, the caregivers had received the benefit for 11 months, so about a year. And so the total number of months that the individual was that the aggregate group in the community was about 14,000 months in the community rather than in a long-term care facility. So you can see that there are some, and these are preliminary analysis, some benefits to incorporating a caregiver benefit. There'll be a probability that they'll be less likely to be admitted to long-term care. And they estimate, Warner et al., that if all those eligible had received the benefit, then there could be 1,300 less admissions to long-term care per year, which is fairly significant in our province, where there's about 2,000, 2,300 on the waiting list to get in. So when we looked at it, we could see that there was a net gain in terms of dollars of introducing the caregiver benefit in Nova Scotia. And so there's growing evidence. It's not complete yet, but we're certainly actively engaged in this. But let me just caution at the end to say that there are some challenges with introducing financial support. And myself and research associate Beth Rajanovich wrote a paper on this. Should we pay or not to pay? Looking at some of the debate around this whole issue. And what we did from the literature was really synthesize and think about some of the ethical issues involved in introducing financial support. So these are what we would consider challenges that you need to be addressing. So should we introduce money into a care relationship? The challenge that we hear oftentimes, are we enabling payment for something that was previously done for free? And the question then becomes, who's responsible for the care of the older person? Is it the family? Is it the state? Who ultimately is responsible and at what cost? So if people are living in poverty because they are providing care, how appropriate is that? And so this sort of introducing money is one of the key issues that fuel this debate. Does providing money, does providing financial support help or negatively affect women? Because there's an assumption that people, it's positive because you're providing some additional funds for individuals to have a higher quality of life. At the same time, are you condemning them to a future of poverty because they're out of the labor force, they're not engaged in employment, and therefore they won't have access to pensions? So do these financial support programs support or negatively affect women, who tend to be the highest number of caregiver? What's the right of the individual client to actually be empowered to choose who he wants or she wants to have provide that care? So why are we giving a system that those individuals have greater opportunity to provide that care? And then finally, there's this woodwork effect that people feel that the costs are overwhelming, that if we start to introduce financial support, everyone will sign up for the care. Although, as you can see with the Nova Scotia program, it's only about 10% of those that are eligible. And so there's some learnings, I think, from that as well. So just in summary, some of the directions I think we can consider is looking at workplace policies directed to employees. Best practices, I think the report that was just released, When Work and Caregiving Collide, is a really good example. There's a whole chapter on what employers may want to consider, some practical suggestions around assessing what their need is and what the benefits are to introducing policies in their workplace. So I encourage you to look up the report and apply those to if you're an employer. There's a direct support policy to all caregivers, including employees, and we can increase that direct service policies and try and provide an assessment then of caregivers' needs to try and really target the best services by including the caregiver in the assessment. And there's a policy brief on the importance of caregiver assessment that will be as an essential component of continuing care policy. And really, from perspective of, it's not coming up that well, but there needs to be an examination of this issue from multiple policy domains. I don't think we can put everything in the workplace domain or everything in the financial support domain. We need to really look at multiple domains as well as the service needs. So I know what you're going to say, we can't afford it and it costs too much. And I want to point you to this article that we wrote in Canadian Public Policy, which really looked at some of the costs. We had done projections of the whole population in terms of need, the cost of compensation over a 50-year period actually going out, and the cost of introducing additional respite services. But then what was the cost of not doing anything? And I think that's where it really came to be. While we're talking around $2 billion, just over, up to $5 billion towards 2031. What's the cost if people went into a long-term care facility 3 months earlier? And this was given at the time in 2007, suggesting that, you know, it's about $4,000 in the facility. And so in 2001, it would have been around $6 billion. And in 2031, it would be $11 billion. So even though these policies seem to be additional costs, the question then becomes, can we afford it? It would cost too much. We really need to think about those economic, social, and healthcare costs of not supporting it. So I guess my message is that they are important, these individuals, family and friends, and we really need to figure out how to best recognize and support what they do. And here are some of the additional links for you that if you're interested in some of the recent reports in this area. Thanks.
That's great, Janice. Thank you so much for that that overview and for sharing with us those links. Very interesting work that you've been doing. So you've heard now from Dr. Sinha and with him Dr. Anderson about the project that was conducted and the work that they undertook. And you've heard from Dr. Keith some of the policy options and challenges that are presented in this area. We now have time for questions and answers from the group. And again, I invite you to chat, using the chat function, direct your questions to all participants. And what I will do now is just moderate some of the questions that are coming through. We do have a couple, but I encourage you to just type them in as you think of them. So I'll start with the first one that came up. So one question, this one's from Sandra McLeod. Before someone becomes a caregiver, what would be the top 3 things they need to know before they start this journey? So maybe Dr. Keith, you want to start, and the others can jump in.
Okay, sure. That's a great question, and I think coming from the policymaker, there's a whole emphasis on caregiver readiness these days, and are we thinking about what it is that caregivers need? And I guess from my perspective, one is trying to understand what is it that you're able to do? What is your capacity to provide care, and what type of care? I think we all have different gifts. That's a little bit psychological here, but I think we really need to think about that in terms of our own situation. And we also need to, I think, really as early on as possible, there's a 40-70 rule that's going around where if you're 40 years old, or if, and this is particularly applies to aging parents, if your parent is in their 70s, you really should take the opportunity to sit down and talk with them over a series, not just a big talk, but have the opportunity to understand what they want in their later life. What is it that they are willing to do? Where do they want to be? You know, it's kind of like providing opportunities for families to have that dialogue and be able to understand what people can do and what they're not able to do. And so I think that's a really critical point that people have to come to grips with. And they need to be thinking about what's available in terms of the way in which publicly funded systems and voluntary sector can help individuals to stay in their own homes.
And Dr. Sinha or Dr. Anderson, do you want to add anything there?
Yeah, no, I was almost late to this call because I was just in a family meeting again, with it was a family, and the principal caregiver, the spouse who lives at home, and again, she's now looking at playing a caregiver role, and so as Janice, was saying, I think the key is understanding what is the the diagnosis, the situation, of the person who may need care. in this case, this gentleman has dementia, and so this is a lifelong illness that will be progressive in nature. And so making sure people understand what they would be dealing with, in that part, as Janice was saying as well, what's within their capacity and capabilities, both financial but also emotional resilience, and what are the family supports available. And then also, what are those supports available beyond, the family unit, if you will. So what are the home and community care services, what are the strategies, what are the options, and most importantly, what's in line with what the care recipient actually wants. So, these are the things that we often have to go through, but I think the sad part is most caregivers are, if you will, kind of caregiving in the dark. We don't really kind of give them that roadmap for them to at least, work with this in a systematic way, and I think that's often what leads to a lot of stress and burden in these cases, and when people don't have a chance to really plan through what a caregiving role would entail.
Thanks, Dr. Sinha. Another question from Terry. How can local caregiver groups best be supported, especially in light that they are often run by volunteers and are getting burnt out themselves and unable to really have the resources or means to provide the most optimal educational information and social support? So, Dr. Sinha, do you want to start with that one?
In terms of, what are the supports for caregivers that are available?
Yeah, so how can the local caregiver support groups best be supported?
Yeah, it depends. I mean, I think the key is, that I've been really impressed to see, caregiver groups of all sorts, shapes and sizes around, around the country. Because some people talk about we need a national caregiver strategy. Other people remember that, things are local and there's just different jurisdictional things available. So I think when we start thinking about how caregiver groups can be useful, or what supports they can provide, I think the biggest vacuum that I often hear is that about information. Just helping to make sure that people have access to information to start a caregiving journey, whether they want to explore being a caregiver or whether they're actually a caregiver and they need advice, support, and direction on how they can actually move forward. Other, caregiver groups can become even more sophisticated in terms of becoming the providers of services as well. So, a number of the branches of Alzheimer's Society, for example, in Ontario and in other jurisdictions, apologies that I'm competing with the construction in our hospital here, but in some of the cases, they will actually start running local day programs and other services. I think, again, it really comes down to what is within the capacity of the local group that wants to do this. But I think the most important thing is understanding, what their role could be, how they could be an enabler, especially at the local context. And I think the advocacy role is always a real key role that these groups can play as well.
I would just add to that, I mean, I think there's, and this is, Janice alluded to this, there's different versions of caregiving. There's the sort of after the acute event caregiving, like, mom got her hip done, she's coming home, someone needs to take care of her. That's a world where you can probably have a care plan, right, where there's stuff you could read and about what mom's expected to do, and most people follow the same course. I think what you find with things like dementia and multiple chronic illnesses is that there is no care plan. Everyone is unique in a way, right? Every family is unique in about what resources they have and how they interact. So, for the first one, which is sort of a complicated one, is actually kind of like here's a care plan you can follow. And the second one, we just have to be there to support people, right? It's the idea between sort of a complicated issue, which is like, getting a rocket to the moon, which you can actually engineer, versus a complex issue, which is like raising a child. I mean, in some cases, like taking care of an older parent with dementia is actually like raising a child, right? There's some general services that can be provided, but what works is going to vary from family to family.
Can I just add, I mean, the challenge around the local caregiver organizations, I think it's almost a shift in our society. I mean, I don't think our voluntary sector has necessarily, I'm kind of going out on a limb here, but has necessarily shifted with the demographic shift. So we have lots of different service groups and organizations, and I know they're struggling for volunteers as well. But a lot of their emphasis tends to be on the youth and boys and girls clubs, et cetera, there may be fewer of those in their local community now. And so I wonder how we can shift this to have these, philanthropy organizations be more supportive of organizations that are providing help and support to older individuals. And I say that because I was at a meeting last night about, they have these sponsor a child to so much a month in Africa. They've actually extended it to sponsoring older persons in Africa who may not have the middle generation because of the HIV epidemic. And I thought, wow, that's cool. They've shifted their thinking, and I think we need to do that here as well.
I guess that's trying to pick up the same theme. It takes a village to raise a child. It takes a village to take care of an old person too, right? And
it takes a village. It takes a village to provide support to each other. If you're going to be a village, if you're going to be a community, it doesn't matter what age you are. I guess.
The only other thing is, it's the kind of the slippery slope that, do we saying that, oh, we have a great, group called Caregivers Nova Scotia, or we have, a local caregiving group here. And then, the slippery slope is, well, we have them, they should be providing these services and that, and therefore it becomes an impetus for the government not to do that, right? And so I think, how do we balance that in terms of our expectation of individual caregivers and also organizations when perhaps some might see this as a downloading of responsibility or support, which may be, in some cases, beyond the appropriate capacity of a caregiver organization as well.
Yeah, that's a good point.
Great point. And I guess just another comment, the quality of the care that's being provided by a caregiver, should they be an in-home caregiver, how is that monitored and assessed when that's the case?
So you mean the quality of the care provided by a family member?
Yeah.
Well, I think that is often a big issue, and I think that's why you have the importance of the education and support groups in the local area, because most individuals are in fact providing care because they want to, and if there's issues with quality, it may in fact be more about people's not understanding the best way to do something. And so, I think there is not, in the same way, unless there is an abuse situation, there is not a mechanism for quality unless the individual is being funded through the provincial program.
I mean, I think that's the key point. Once you put money into the caregiver relationship and it's public money, there's sort of the accountability stewardship piece there. Like if I'm giving money, I should have some standards around performance, right? And I thought that was really nice that you brought that up on the slide, Janice. That's one of the things that putting money in the relationship does, right? Especially if it's public money, is there's now an expectation of some oversight. And if there is no oversight, it gets more and more difficult to justify in a economy where money is tight. So, value for money could even apply to this area, in which case we do have to have some performance measures.
And kind of along that lines, from Jerry, in Canadian jurisdictions that have implemented innovative caregiver supports, what has made the governments change their mind? So what's been the reasons or the work behind making governments put these policies into action?
I think it's really the sheer number trying to help people. Like most people want to stay in their own home. Most families want to be able to facilitate an individual staying in their own home. Some families are not able to afford it, and they need the flexibility of being able to have somebody at their discretion to be able to come in and provide them support when when they do. Like, we don't have a lot of data on this $400 a month. For example, it would be fascinating to know what exactly those family members use that money for, right? Is it for often respite for themselves that they can't get at a time and place when they need it from the public system? So what's been the impetus? The real impetus from, I think, our government is that we have one of the oldest populations in Canada. We don't want to build any more nursing homes. We're trying to figure out how to help people stay in their own homes, and we need a lot of different ways to do that. One way is financial support, but it's not the only way. I mean, for some families that doesn't work because they don't have the capacity to be there. They need home care services. And even the people who get financial support are eligible for home care services. So, yeah.
I guess along that lines as well, there's a comment that we know that caregivers often don't engage supports or even recognize their roles. Their role as that of a caregiver until they're overburdened and stressed. Are there any systemic supports or mechanisms to help caregivers recognize their roles earlier on and encourage advanced care planning? And I'll just also mention a comment around how do we engage family physicians to recognize and support family caregivers. So does anyone want to comment on those two questions?
Yeah, I think just building on the previous comments that Janice was making, I think governments and political parties are certainly getting much more engaged in this issue because, when you're realizing that how many people need support to age in place and at home, and that for each of those individuals who are receiving care, they're attached to, one or many caregivers, that all of a sudden this is actually not only there's a big demographic shift happening where caregiving support is increasingly needed, but that we are going to increasingly need to rely on these caregivers for the economic health and well-being. And frankly, these caregivers are also getting sick and tired of maybe the lack of supports that exist, and therefore becoming more politically vocal and active as well. So I think there is there is some interest. Why I think we had if I could put up my cynical hat on, I think there's some interest. There's a lot more political interest, or we're seeing caregiver issues becoming political planks and platforms and so on, because I think people realize this is a top priority for a lot of people out there who are voting age. I think the next part is, so that I think part of the good work that's going on is then thinking about how do we actually make sure that thoughtful policy and planning actually take place in this way. So you'll see that as we look through the jurisdictional scan, and we started saying, wait, wow, there are a bunch of provinces in Canada that offer some form of tax relief, but you'll have heard, through Janice's presentation, this is refundable, this is non-refundable, this goes to everyone, this is means tested. You can see that in some cases, there might have been political motivations in terms of how something was doled out as opposed to looking at the evidence and how does it work. I think overall, what governments and I think what collectively, regardless of whatever political stripe one is under or whatever philosophy, I think, as Janice was mentioning, people want to age in place. And not only do people want that, but we actually know from an economic standpoint, it's the cheapest thing for the government if people age in their own homes, far cheaper than long-term care, nursing homes, and far cheaper than living in hospitals as well. So there's an economic imperative to actually support people to age in place. But I think where this actually leads to is we need to really create a system of care that enables this. So how do we engage family physicians to recognize and support? This means that, we make sure that this is part of medical training. This is part of the training of care coordinators in the home and community care sector to think about the needs and recognize the needs of caregivers. We've got to have those policies in place that really start to allow those conversations to occur. We need to make information much more accessible. We need to make sure people are informed so they know, hi, I'm a caregiver. I know that there are supports available. This is where I go. So it really talks about a systemic policy, but I think the real political motivation, in my view, is this could actually save the government a heck of a lot of money, governments at all stripes. Therefore, I think that's the motivation that I see working. But how do we take that motivation and make sure it equates into thoughtful policy that actually works.
Right, right. I just want to draw everyone's attention to the post from Stephen Lott. He's listed a link to the McMaster Health Forum's Improving Care and Support for Unpaid Caregivers in Ontario, a deliberative dialogue, I believe. And so the link is there, and he's also provided a link to one of Janice's earlier presentations. So I'll just invite people to have a look at those, and we could probably circulate them again after the presentation.
Yeah, okay, great.
Another question Raquel has asked is for caregivers who are considering approaching their employers to request support, do you have any tips for them or any resources that could assist or guide them?
Oh, that's a great question. I would encourage to look at the report that was just created by employers, because I think employers speaking to employers will be a positive way forward. I think there's a lot of examples of creative solutions that I had not even thought of, and that may be beneficial when you're going forward to an employer. I mean, thinking about first, I guess, what is it that you want, what is that you think is reasonable, and how do you propose, like a proposal of going forward to do that. And I think there's some really interesting examples of creative solutions. I won't go into them all, but there's everything from, having a guaranteed parking space to make it easier to run in and out to check on your loved one if they live in the area, to using technology from a distance to be able to do your work while you're in different areas, and really understanding the role of the EAP programs and pushing your providers to actually have good information about elder care. I think they've cracked the child care, but there may be less expert in the other elder care field, at least some of them. So there's definitely take a look at the report.
I also think that building on that again, that there's I have hammering and drilling now here. Apologies. I think one of the interesting things that we've seen is that again, because caregivers are just now starting to really come into their own in terms of saying, like, I need to think that I want to be in a work environment that's actually going to support me. This is this is an important issue, and that more people are wanting to be both stay in the workforce and caregiver as well. But it's interesting because I think a lot of workers don't know to ask their employees and advocate with their employees about those things. They just might assume that that's the non-starter. But now but interestingly, I remember the Vice President Human Resources for one of Canada's I can't tell you which one, so one of Canada's largest banks, actually, looked into it for me in terms of this aspect of their employee assistance program, because this bank in particular provides emergency elder care services and a whole range of things, but then sent me a comment and said they were actually quite surprised that over the last 5 years they're always well under budget, and that started a conversation with them that they don't think that most of their employees know that they even provide that service. They're all well aware of the child care services, but not of the elder care services. So this is where, again, there's an opportunity for employers to realize that in a much more competitive environment, especially when the number of workers, we might have skill shortages and worker shortages, there really is an opportunity to actually to be more competitive, and by actually working on this as well.
Can I just add something about the physician? I know it's back a little ways, but it's we've just done a dementia strategy here in Nova Scotia, and one of the challenges, and I don't know how this happens, is the whole challenge of confidentiality in the physician office and not including the caregiver in that physician visit, particularly with people with dementia. I found that challenging to understand why some physicians would not allow spouses in the visiting room with them, or even adult children, and I think that's just one area that maybe we need to have more family type visits to the physician, so the caregivers actually know what the diagnosis was, because some are not they don't even know what they're dealing with. So how are they able to plan for it? So again, there's important reasons why we have these ethical issues or safeguards around confidentiality, and then they get taken to the extreme that does not fit certain situations. So we need to be more aware of that, and we need to teach new physicians about that, I guess.
Absolutely. I just want to go back to the previous discussion too about the work and caregivers who are in employment, and just mention that CIHR, together with the Social Sciences and Humanities Research Council of Canada, we're going to be launching an initiative. It's a new signature initiative in the area of work and health, and part of the focus on that is aiming to develop innovative and evidence-based solutions to workplace and labor market health challenges to improve health and productivity of Canada's diverse workforce. But a key element within that is older workers and workers with caregiving responsibility. So I just want to mention that, and those on the call can keep an eye out for that. So another question that was asked, Lynn, any advice for caregiving support needed by someone that has a lifelong condition, but where the disability is episodic, so something like arthritis or mental health? Janice, do you want to start with that one?
Okay, sure. I mean, with all individuals who are within those episodic, it's such a challenge to have a steady layer of support, because it's up and down and can be discouraging. But I mean, I guess I'm trying to think of the best way forward in terms of trying to find some support for individuals who are, you know, having a support group within communities to be able to facilitate that, and also to be able to meet with, if additional sort of formal support is needed from a home care program, for example, in bathing, et cetera, personal care, if that's something that can be addressed with them. I'm not 100% sure because of the episodic nature, but I certainly understand how difficult that may be within the current system. But there may be opportunities for things such as self-managed care, which enables people to have more flexibility of when they actually get the support that they need, so that it's not in that sort of routinized system within a home care program. I don't know if that's helpful, but yeah, that's all I can think of at this point.
I think it's important, that people, realize, again, what is the caregiving phenotype, if you will, that they'll be involved with, right? So the person who may have a very stable kind of ongoing condition, which is, I think, more the minority of the situation, versus kind of those conditions that may have episodic issues. I always think of dementia, for example, or maybe other ones where, like, congestive heart failure or other issues that can flare up and lead to acute care admissions. So, this is where, someone thinking, going back to that original question of what advice would you give to a caregiver, it's really understanding the illness and the trajectory. I find too many caregivers in my office and my clinic, for example, who just, they were told, the beginning of the story, but they were never told what to expect, what was the overall plot and theme and what would the end look like. So I always try and make sure that at the start of a diagnosis, people have a quick snapshot of what this might look like, really kind of do a needs assessment to say, do you have a flexible environment, working environment? Do you have families and friends who can rally around at certain points when needed? And do you have the financial resources to give you the flexibility you may need? Or are there resources that we can rally in the community that we may need when those situations occur, for example, including when the caregiver themselves might be having their own health issues. So it's a number of times where caregivers are often putting off getting a hip or knee replacement because they say, well, who's going to look after so-and-so? But this is where, in that episodic situation, by working in partnership, we say, you know what, we can actually put them into respite care for a few weeks, or we can organize a family to another family member to maybe take over that primary caregiving role, to give that caregiver the time for them to not only get their surgery, but their time to heal so that they can resume. So again, it's about being informed of what's available, understanding what things could pop up, and then how could one access those things to enable them as well.
Thank you. Just looking, we've got just a couple of more minutes left, and I want to draw everyone's attention to the chat box with a comment from Catherine and a link to the work of the Canadian Caregiver Coalition and a project called Mobilizing Action, Family Caregivers in Canada. So I invite people to look at that, and she's also given her email address there for more information. And another question or a comment from Raquel, just to around caregiver-friendly workplaces that are just starting, and some of the work there through the chair, CIHR Chair in Gender and Health. So I invite you to go to the website that she's listed. And so probably just time for one more question here. Are there examples of innovative supports for caregivers caring for different needs? So, for example, fragile senior parent and adult child, developmental disabilities. So examples of innovative supports.
So, yeah, you go ahead. You go ahead.
Again, I think there's a variety of things that are happening across the country and around the world, and but I think a few interesting programs I saw in Ontario were really focused on filling in gaps with some flexible supports and services, to aid caregivers. So in Toronto, for example, the Regional Health Authority here gave money to the Alzheimer's Society and they work with a local home care agency so that individuals who may be caring for a loved one with dementia, for example, can apply for a special caregiver grant. So this is not administered through the government, but it could be a small sum of $500 to $1,000, which can allow for flexible, it's almost your own special caregivers account where you can use that money to buy some respite, maybe, have a day at the spa if that's, what it'll take to recharge you. Or in one case, one of my patients, he was, his caregiver was a friend who lived in his building. And when we transported him to palliative care, to a palliative care unit, for example, she was, her big desire was to have somewhere that's close at hand, and she was able to use the rest of the funding to pay for taxis to get her there and back, because she's 80 years old herself with her own abilities. Other initiatives have really focused on saying if we don't actually have respite services available, we can give cash grants out in other areas where people can actually use that flexibly to organize their own respite. So I think some of the innovative things I've seen, just in summary, around flexibility and some funding supports as well, where traditional systems may fall short.
Yeah, I mean, I think that's the key issue around innovation is the flexibility. I know that in our province we have community development funds from the capital districts or community health authorities, and they can give out small amounts of money to help foster positive education and health in their community, in their local communities. So they've done, educational workshops and supports, including transportation, which is such a difficult issue for caregivers, including respite, so that they can actually get to some of the support group sessions. So really trying to look at it as a full package to enable people to get the information and support that they need. So I think that's, but I agree with Samir around the need for flexibility in many of these different approaches. I mean, there's examples of, the models of some of the caregiver organizations where, through some government grants, they've actually been able to broaden and expand their support groups, at least in our province, in all regions of the province. So really trying to get the message out there to be that support person for the caregiver individual, and a real emphasis on using broader systems to be able to target information for caregivers. So whether that's using the 211 system, the Minister of Seniors has a whole by province portfolio of policies for caregivers that people can access. So there's a whole range of different approaches that people have been taking.
Well, folks, we have run out of time for today's session, but it seems like this is one we could take a whole day to discuss. I really want to thank you for participating. I will flag here that there is a survey that will come up so that we can get all of your feedback on this session. It helps us to improve future sessions, so thank you in advance. And I really want to thank Dr. Sinha, Dr. Anderson, and Dr. Keith for joining us today and having this really interesting discussion. Clearly something that has a long way to go and lots more research to be done and policies to be implemented. So on behalf of Hawa and myself, thank you all for joining. And we can keep up the chat box for a little bit longer if people want to absorb what's there. There's been a couple of good links listed and some comments that I think people might want to reflect on. So you will see shortly the presentation from today. You will be provided with that, and so a notice will pop up in a window and it'll allow you to download the document, so watch for that as well. And just a quick note that on March 9th, we will have another another IHSPR policy round session, so a webinar featuring Esther Sutter with the Alberta Health Services and focusing on policy levers to advance innovative care delivery through a team-based primary health care in Canada. So watch for that. And again, thanks to all of you, and particularly the speakers for joining and everyone for engaging. Have a great day, and we'll see you next time.
Thank you.
Thank you.